Hey everybody, Dr. Eric Herman, the Guru Chiropractor. Peace and love to everybody out there. And official Team Ring Dinger Doctor of the Northeast. Proud to represent. I'm here again for another video with my current new patient, Big Tony. What's going on, sir?
How you doing?
Good. Tony's from?
Massachusetts.
Yeah, Massachusetts area. But he didn't come down just for me. His parents live in Jersey.
Correct.
Right? So you're visiting the parents, and while you're here, you kind of parlayed it, and you made an appointment to come for the ring dinger.
Exactly.
Right? But you've been following me for a while, or just the ring dinger in general?
Yeah, I found you about a year ago or so, and the ring dinger I've been following for maybe close to 2 years now.
Gotcha.
Yeah.
All right, well, I appreciate you taking the ride. You came from Bergen County from your parents' house, but via Massachusetts.
Yes, sir.
Gotcha. All right, so Tony's got some stuff going on. He's got some chronic back pain. I'm going to just review the notes. For constant for about 8 years, yes?
Yeah.
Or is it just constant lately?
Yeah, on and off for 8 years, but in the last, I'd say maybe, 3 years been constant.
Pretty constant, yeah.
For sure.
And also sciatica on the left, right? All the way down to the foot, and you have pain shooting down, and you also have some numbness and tingling, which is called paresthesia, into the foot, right?
Yes.
And that's also frequent, but the only time it really goes away is when you do some home traction to stretch it out.
Exactly.
But then frequently, soon after the traction, it comes right back. So the traction at home is not resolving it, but it's managing it a little bit, so at least you're not suffering all the way through.
Yeah, it's been helpful.
Right?
Yeah.
Helpful.
Right.
And we talked about that off camera. I want to make a point. When patients tell me that self-care is easing the symptoms, that tells me that they're a lot more treatable. In other words, there's a much higher probability that the treatment's going to help them, as opposed to if somebody walks in here and says, Doc, I've had constant pain for the last 5 years, and nothing I've tried that does anything to touch it. When that happens, I don't get nervous, but I'm going to go, oh God, this might be a tough case. Mm. So good, I'm happy, and I'm expecting high results for you because of saying that. Plus, I'm good.
Yeah.
I'm just messing around.
Yeah. As well.
You said right now, well, before when we did the health history interview, you said the pain was a 4 or 5 out of 10, right? Also, you got some neck stiffness and some daily headaches too, tension headaches wrapping around. And we talked about that too. The most common cause of headaches, not the only cause, but the most common by far is stress in the neck, referring up to the head. So if that happens to be the cause of your headaches and we do a good job releasing the neck today, that also should impact the headaches, hopefully.
Awesome.
You'd be happy, right? If that happened?
Big time.
Added bonus?
Yes, sir.
Awesome. All right, let me see if I'm missing anything. That seems pretty good. You got some trauma in your history and some surgical stuff. So you had a patella or a kneecap dislocation.
Yeah,
Recently, and that was repaired. So we're not going to be on the right side. So we're not going to be doing a knee pull there. We're going to leave that alone. And you had a pretty traumatic, is it left ankle fracture or right ankle?
Right was the club foot.
Oh, that's right.
Left was the fracture and plate.
Right. So he was born with club foot on the right.
Yep. And
they did surgery when you were, 3 months old?
3 months, yeah.
And he walked in, he didn't even have a limp, which is really good because that's not how it used to be before they had advancements in the surgery. You had a club foot and you were pretty much limping for the rest of your life with wearing big, that one foot and the brace and all that. So that's pretty amazing. I looked at your gait walking in and it's pretty normal.
Yeah.
So I think that's cool.
There.
Yeah. Amen.
Sure.
Modern science and surgery does help. I'm not anti-surgery. I'm avoid it at all costs, but if you really, really need it, of course, get surgery. I try to help prevent people from having surgery, but if you really need it and nothing else conservative is helping, or if it's like a life or death risky thing and you gotta just, I'm definitely pro. Just want to let everybody know out there. I'm not like radical. And then in 2013, you had a nasty fall and you had a right ankle fracture, and then they put some hardware in there.
Left. Yeah. That was So the left ankle fracture was 2010. We were playing rugby.
Oh, there you go. I'm sorry. I'm confused in my.
Yeah. What did I say?
Oh, you had a bone spur on the right ankle.
Yes.
That was removed in 2013.
Yep.
Yeah.
There you go.
So there's some stuff going on down there. So we're not going to do a full body adjustment today. We're going to avoid some of the ankle and the knee pull. But the back, 100%. We're going to do. I'm going to do my very best. He's going to get a full body in a ring dinger today. So hopefully that's going to help, particularly in the low back, because that's been chronic for a long time.
That's the goal.
Got it. All right. Anything you want to say that we didn't talk about yet before we're going to roll into an exam?
Yeah, just I mean, the biggest symptom that I had, recently that was really driving me towards, being more proactive about my treatment was trouble sleeping, and this feeling of kind of like anxiety. I thought it was anxiety, which I've really never had, and so I kind of thought, oh, maybe I'm getting older, have some anxiety, some call it keeping me up at night. And then I started, using this home traction device and discovered, okay, it seems to be directly related to my spine and my back. But it's not, as Dr. Herman said, it's not lasting relief. So here I am.
Yeah. So just to follow up on what he just said, basically he was experiencing some emotional stuff, some anxiety and even some mood swings and stuff, and also affecting your sleep
disturbances. Yeah.
And he started to do. He bought a home traction unit to help his back. But what he noticed, it did help his back when he was doing it on a regular basis. But what he also noticed was it helped with sleeping and it calmed you down a little bit, right?
Yeah.
So
sleep relief. Yeah.
How the hell does that translate? Well, because the spine houses your spinal cord. The central nervous system is right there. And when you have compression, it's not just affecting your bones and your nerves and your muscles. It is affecting your nerves, but it's affecting your central nervous system sometimes, which could affect all that other stuff. Right. And when you get a good release, what I see with the ring dinger is people very often after they get a ring dinger release, they're like zenned out. They're more calm. They look like they just slept like the best 12 hours of their life. It's almost instantaneous from before and after. They look more refreshed. And they report to me all sorts of things like calmer, better digestion, better sleep, better breathing. All this has to do with, it's kind of like a reboot to the central nervous system. It's not a direct treatment. I don't directly treat anxiety. I don't directly treat sleep disturbances. That's not part of my scope of practice. But indirectly, by releasing the spine, there's some kind of a nervous system reboot, and it's beneficial. So hopefully that'll happen to you too for today. Yeah, that'll be great. All right, so let's roll into an exam. I'm going to put my clipboard down. I want to check the neck and a little bit in the shoulders first. So come have a seat here on the stool facing that way. Yep. Good. So from this point on, anything I'm doing to you, if it doesn't feel good, let me know right away. Okay? Otherwise, do your best to relax. And we're going to do a little exam here in the neck, even though you don't have any major complaints, just a little tightness. I want to see what's going on. Okay, so I'm going to I want to see how well you're turning. So I'm going to, you be passive. I'm going to turn your neck around a little bit. If it gets to a point where it bothers you, let me know right away. Okay, I'm not going to go any crazy. I'm just going to slowly turn. Okay, so that's right rotation. Not horrible. It's only about a 5% deficiency, maybe a little bit further, but not horrible at all. Go to the left. Again, not too bad at all. I'm not even, that's not even problematic. Tilt. Good. Tilt the other way. Reminding you, let me know if I'm moving and it's bothering you, like if it causes any pain or discomfort. Go backwards. Any jamming or any pinching or any pain going on?
A little bit, yeah.
Like right in the lower neck, yeah. Any dizziness in this position?
No.
No? Good. Come on out of there. Chin down as far as you can. Okay. Normal, you should be able to touch the chin easily to your chest. So there's definitely some restriction there. Do you feel it pulling here? Tight, getting tighter?
All through there and up here.
And here too? Any pulling down below or just up top when the chin goes down?
Like maybe the lower part of my shoulder blades.
Like here?
Yeah, exactly.
Yeah. Okay, come on up out of there. Now I'm going to do what's called a cervical compression test. Mostly it adds compression to your upper part of your back, but sometimes even down here. I'm going to push down on your head a little bit. Nothing crazy, just a little bit like this, but on top of your head. Let me know if that causes any increase in discomfort either here or even down in your lower back or not, okay? Stay relaxed. Anything go ouch?
Yeah, just in the neck.
Up in here?
Actually.
Yeah.
Kind of like up here.
Up there?
Yeah.
Okay. So that's kind of like a confirmation that there's already compression, because pushing a little bit push down on the neck when there's no compression shouldn't cause any discomfort whatsoever,
Gotcha.
right? Now I'm going to do the opposite. I'm going to give a little stretch upward, a little distraction. Let me know if that feels good, better, like I like it, gives you any relief from any symptoms or not. Stay relaxed. And coming down slow. In general, how'd that feel?
Fine.
Like good, I like it, kind of neutral, blah, or I don't like it. Those
neutral, I would say.
neutral.
Yeah.
Okay, not so much going on in the. Oh, you know what? I forgot one other thing. You did tell me you were getting some numbness and tingling in your hands too at certain times. What, after a certain amount of time in front of the computer, or?
Yeah, it was normally laying in bed on my phone.
Yeah, so in a certain position where you kind of head cocked up a little bit. Yeah, so that puts abnormal stress in your neck anyway, just by staying in that flexed state.
Yep.
But it really shouldn't cause this unless there's already some compression there, which already we know there is because you had a positive compression test.
Right.
So it is affecting the nerves in certain situations where you're pushing your neck and stressing it a bit further. So hopefully that'll also go away too once we decompress the neck. Hopefully. Awesome. You'll have to let me know when, after you try to read in bed for a while, next week or two. See if it doesn't happen as often.
Yeah, it didn't always happen. So and I feel like
it's not normal, by the way. People think, oh, that's normal because I'm torquing my neck. No, if there's already if the neck was healthy and you're doing that, you really shouldn't get anything pinching here.
Right.
Only if there's already some compression going on, and then you flex it and stress it even further, it tweaks on the nerves.
Makes sense.
Yeah. All right. So I'm done with the neck. Now I want to check that lower back. I'm anxious to look at the lower back because that's your main problem. So go ahead and lay on that table face down. Put your face where the where the paper is. Hands on those side rails and try to get as relaxed as you can. And let's see what's going on. Slide down a little bit towards me. There you go. All right. First thing I want to look at is posture. So posture doesn't look too bad at all from this perspective. No torquing really in the hips or pelvis. And no unleveling because I don't see it, and also your heels are even. But I will say, as you're laying here, Zach, can you come over here for a little bit? Look at his feet. Come over here and look this way. See how his feet are, both of them are kind of cocked off to the right? That's an abnormal thing going on, probably from his pelvis. All right, if you want to go back over there. So what's going on, Tony, is you're laying. Normal, your feet should be just straight down to the floor, parallel. But you're both of them. This one more than the other one is turned off to the right. Yeah. I see this big scar. Huh? That's from the.
Yeah, that's from both.
Both surgeries.
Surgery, a clubfoot surgery, and then the
Achilles tendon.
Yeah. Yep.
Okay.
Back there too.
Yeah. Pretty nasty. You could tell stories about that to your grandkids.
Oh yeah.
All right, now I'm going to do a little palpation exam of the hips and pelvis. When I generally just palpate it, it doesn't feel horrible, but definitely feels a little jammed up in the lumbars, and worse, the right sacroiliac is pretty jammed up in here too. Both sides are tight, but this side feels worse. When I press down under my thumb, is that sore or tender?
Yeah.
Yeah.
Really tender, right?
Okay, so that's a sign, that's a sign that there's inflammation going on here as well as compression. Some people have compression without inflammation, and some people have it with. You have it with. Anything sore here when I push?
Oh, yeah, it's definitely tender. Yeah.
Tender, okay. Some there too. How about on the left side?
Not as much.
Not as much? Yeah. To me, it doesn't feel as bad this side compared to this side. Now I'm going to do a couple orthopedic tests to further evaluate. First thing I'm going to do is just simple bend up your knees, right? I'm going to do it. Normal response, you should just feel it stretching the front of your thighs. So if that happens, I don't care that there's nothing, that's normal. I don't even need to know about that, right? Okay. But when I bend up your knees, if anything here in your pelvis and your lower back, anything here gets tighter or pain increases, let me know. That's a problematic experience. Okay? Ready? Bend. Bend, 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 bend.
Yeah, it's definitely getting tighter.
Where? Middle or more on one side or the other?
Like lower back and both sides.
Okay.
More on the right side.
So lower back and both sides, but worse on this side.
Yeah.
Yeah. Based on my palpation, this is definitely tighter. All right, now I want to check the actual range of motion of your sacroiliac joints. The sacroiliac joints are the joint that connects your tailbone to your hip bone. You know what? I never show this. I'm going to show it on my spine so that the people out there can really get a visual of what the sacroiliac is. The tailbone's called the sacrum, and these big Mickey Mouse ears are called iliac bone, and this is the iliac crest. When the joint that connects the sacrum to the iliac is called the sacroiliac joint, okay? And when you walk, they do this. And your right side is really jammed up and your left side is a little bit jammed up. That could be where the sciatica is coming from. It also could be coming from a little compression in the lower lumbar spine. Or once in a while, it can actually be coming from a pinched nerve going through a little muscle in your deep in your glute muscle called the piriformis syndrome. But I don't think that's you. I think it's coming from up here or maybe here.
Yeah.
So we're going to evaluate now by him lifting his legs. I'm going to put some pressure here. Actually, you won't be able to see this, but for the camera, I'm going to put some pressure here on his tailbone. When he lifts his leg up, this thing should rotate this way. And then when he does this side, it should rotate this way. But if he gets jammed up and he can't lift his leg too high, that tells me that this joint is jammed up. Okay? I'm doing extra visuals today for the camera. So start with your left leg. Don't bend at the knee. Keep it stiff. Lift it up off the table high as you can. Straight up. Okay, goes up pretty high. Drop it down. Pretty normal range of motion. Did you feel anything abnormal here when you lifted? Any pulling, abnormal pulling or pain? A little tight there? Okay. Let's do the right side. See what that shows. Go ahead. Lift that one. And down. Again, went up pretty good, but how did it feel when you lifted?
It's actually tight over here.
Yeah, so both legs, when they were lifted, felt tightness more on the left? Yeah. All right, so that means there's something jammed up in there. The pelvis is pretty jammed. And when I bent up the knees and it got tight here, that tells me that the lumbars, the lower back, actually the spine is also jammed up. So you got both. Don't worry, I know how to fix both of those. Now we're going to do a little check for the rest of your spine. Not too bad here, not too bad. Once I get about here, though, I feel it's starting to get kind of tight and rigid. Right here. That's between the shoulder blades. All this is really tighter than it should be. And then the lower neck, where the neck transitions to the shoulders, is also really tight. Is that sore?
Oh, yeah.
How about this side?
Yep.
Yeah. Big time compression in the transition area. Hot spot for most people, especially people that have desk jobs. This gets really compressed. And that's probably where the nerves are getting pinched that are causing the occasional tingling in your hands.
What's that spot in the front there that's sore?
In here?
Yeah.
That's just part of the vertebrae, and I just feel a little bump there from the misalignment.
Right.
Boom and boom.
Yeah.
And possibly, I don't know for sure without seeing an x-ray, could be possibly some bone arthritis in there. Yep. Anything sore up here?
Yeah.
Yeah. So this area is the second vertebrae in your neck called C2, or the axis vertebrae. Very big hot spot for headaches. That's why I went there and I wanted to do a little extra work there. And if it's sore, high probability that the tension headaches are coming from your upper neck, like right there. Boom. So we're going to release it and then check it afterwards. And if it feels better, hopefully that'll also help with your headaches. Okay. I'm done with the exam. Nothing showed up for safety issues, so it's safe to treat. And I think this is going to help you a lot. So basically, I'm ready if you're ready.
Yeah, I'm ready.
Okay, stay there. Stay there.
Okay.
We're going to start here. We're going to do a little warm-up massage and stretch just to kind of get the muscles warmed up and loosened.
Cool.
And then we're going right in the back room. We're going to do the decompression pull. See how you do with that. Then you're going to come back on this table here, and we're going to do a full spine drop adjustment, and then we're going to hit all the peripheral joints except for the ones that we're not going to do. Yep. So we're going to do the hips, one side knee and ankle, the other side no.
Yep.
Shoulders, elbows, wrists, even the collarbones, and a little bit in the front of the rib cage. And then we'll see how you're feeling when we're done, and we'll talk about what to do next based on how you respond to this one.
Beautiful.
Your job, same thing as I said before. Stay relaxed and give me a heads up if anything I'm doing to you don't feel good.
All right.
You ready?
Yep.
All right, relax. Come on. Let's do this. So I'm going to use my famous thumper massager just to get the muscles a little warmed up. By the way, Big Zach is behind the camera again. He took a little hiatus for about 6 months. I finally got him behind the camera for me a little bit again. Thank you, Big Zach, for helping me out in a pinch. Yes, and that's the same Zach who books all my appointments. And he's also my offspring, I think. We haven't confirmed it DNA-wise, but... Tickle or hurt? I see you squirming a little bit.
Yeah, no, it doesn't hurt.
It's like sensitive?
Yeah.
Yeah. A lot of times when you have something that keeps banging on that nerve and irritating it, it becomes hypersensitive.
Right.
Some people think it's ticklish, but no. It's hypersensitive, meaning...
It's almost a ticklish sensation, but not.
Yeah.
Okay.
It's probably because that nerve is fired up too much.
Right. Look at this. Good massage gun, whatever that is.
Yeah, I love this company. I keep asking them to endorse me. I push to sell a lot of them, but they don't want to do it. But I've had a thumper massager probably for 20 years. Not this one, but I've had a couple other units, and they're very durable. They last a long time, and they're strong, and they're made in Canada, so it's still considered made in America. So I support Thumper. Thumper.com, or you can go on Amazon, and they have them. They sell them there. This is called the Mini Pro. This is the one I'm using currently. I like it a lot. It's strong, and it's durable, but it's also lightweight, so I can move it around better. Maybe Zach's going to get a ring dinger after this, since he's in my office. He doesn't come very often anymore. All right, all done with the little warm-up. When you're ready, come on up on your feet. We're going in the back room for a ring dinger. Good. Keep your hands up top for me so I can, while I'm getting you lined up, I got to feel the top of those iliac bones to line you up. You're a little high, so slide down about 1 inch. Perfect. Stay right there. Now just relax. I'm raising up the table first.
Good.
And then the table's gonna raise up your legs, kind of bend them up. You'll see that'll flatten out your lumbar spine and relax it, hopefully. Just let the table lift you up, let them bend as it comes up. Feel how it flattens out the lower back?
Yeah.
Yeah. Some people that have really bad backs and they can't get comfortable laying down to sleep, try this position and it gives them relief.
Oh, right.
So just in case, heads up, if you ever have that problem where you can't get comfortable, just give this position a try. It could help you a lot.
Yeah, then I'll come see you too.
And definitely, well, yeah, if it persists for more than a day or two, come see Dr. Herman. Now we got to pin you in. It's got to be pretty damn tight to lock you down, because when I pull your neck, I want your body to stop short, and that's what sends the force all the way down your spine and allows us to get a full spine release, one pull. Very efficient and very effective. Can you handle that? Too bad you're in anyway.
Yeah.
Now, let me have your hands. I just want to make sure you're pinned properly. There's no gap between your hips. Yeah, you're good. All right. You stay relaxed. Keep your hands right there. The towel goes around your neck, but really it's hugging the back of your skull and your jawbone like this.
Mm-hmm.
But my hands are too small to get a good enough grip, so the towel gives me the grip that I need. Your job, stay as relaxed as you can, number one. And number two, keep your teeth, bottom and top teeth, touching together, but don't bite down hard. Just keep it closed, so when I give a little pull, you don't bang your teeth. Because I'm not paying for the dentist. Other than that, I'll do the rest. Lift up your head. Come on down. Good. Nice. All right, you ready to go?
Mm-hmm.
Stay loose. Get everything loose and floppy. Loose as a goose. And boom. Oh. And that's the ring dinger. You feel it release that all the way down?
Oh, yeah.
Nice. Okay. Now you know.
Yeah.
I tell everybody who's been watching as a fan, I don't care if you watch 500 videos, until you feel it, you don't know. But now this guy knows.
Yeah, you think you're going to know, but...
No, you can't. You really can't until you feel it. Same with me. I watched a lot of videos before I committed to go down for training.
Yeah.
But when I got that first pull by Dr. Johnson, holy mackerel.
Yeah, I don't think I've ever
Game changer.
had my lower back crack like that.
Exactly. That's the same thing I said when Dr. Johnson did me. My lower back has always notoriously been hard to release.
Yeah.
I've been to great chiropractors and they always had problems, but when he pulled me, boom, it exploded. All right. Now, by the way, do you feel any different laying here now than before, when you were laying here before the pull?
Yeah. I mean,
Sometimes tension goes away and you feel ease. You know, I don't want to put ideas in your head. Tell me what feels different.
Yeah, no, I was always getting, like, in addition to the tingling and numbness in my foot, kind of like muscle twitching and cramping.
Yeah.
That's totally gone.
Nice.
Tingling's kind of going away as well.
Very, very promising for one pull. A lot of times the tingle doesn't go away for a day or two later because you still have swelling and that takes time to resolve. But sometimes it goes away immediately and that's above average results.
Awesome.
All right. Before you get up, I want to do a little more release in the neck by doing a little twist.
Yeah.
And then we'll get you up on your feet, see how you feel. Relax. Good. A little bit there. This side I feel it needs a little more. Stay relaxed. Good. Let it go. Good. And boom. Okay. Here, we're done. So when you feel ready, come up on your feet. Let me lower this the best I can. The best way to get up when you have back problems is don't do a sit-up, because what that does is it compresses the discs. Turn your body sideways, throw your feet off first, and then try to get up with the least amount of flexing forward. Perfect. Good. Now, when you get on your feet, I want you to stop for a second and evaluate your body. Put your attention into your body and tell the camera if you notice anything different now that you're standing.
I feel looser, lighter, straighter, definitely straighter.
Yeah, your posture's better. I'm just eyeballing you from here. You're definitely your shoulders are back better. Your head's back over your shoulders better.
Am I taller? I feel taller.
Possibly. No extra charge for the lengthening. Good. So you got some relief down there. The foot's still okay?
Yeah. Good. Yeah.
Amen.
Really
All right. That's very promising. Good job. Give me some of that. Let's redo a couple of those orthopedic tests. See how they did, if anything improved with those. Now, after the pull, your left leg is neutral now. In other words, your left foot is coming up and down like it's supposed to be. Your right one is still torqued over. That could be from all the surgery here. I don't know for sure.
Foot,
But also, it could be from up here in all the jamming in the sacroiliac. So once we do a little more loosening here, I'll recheck that. Maybe that will help there too. All right, but let's redo the tests that we did. So remember when I bent it up the first time, you said it was pulling here and a little bit here?
Yeah.
Okay, I'm going to rebend. Tell me if it feels the same or reduced, or sometimes it's all the way gone. Tell me what it feels like now. It's more flexible, see?
Yeah, it's reduced, yeah.
Good. So less pull when I do this?
Yeah, definitely.
And also notice how further it bends, right?
Oh, yeah.
Because what I see as a pretty consistent phenomenon is when this is all jammed up, most people are chronically tight in their thighs, okay? And doesn't matter what you do, you could stretch a lot and you get temporary relief, but it keeps getting tight again. But when this gets released, sometimes these thighs, the hamstrings and the quads loosen without even stretching, like automatic. And when I bent it up, your quads are less tight because it went a lot further before it started getting tight. Okay, now I want to do some drop technique here to release even further. So slide down about an inch or two towards your feet. A little more. Good, right there. Now the belly part's going to drop down. Okay, this part's going to pop up once I hit the right button. And then when I push down on you, it's going to go slam. So I'm going to go boom, 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 boom. Okay, so you know what to expect. I think I have to loosen this a little bit for you. Good. Stay relaxed. Good. There it goes. Nice. The sacroiliac is moving like a champ now. There's no pushback at all.
Awesome.
Can you feel the difference in pressure when I push down?
It's way less tender, that's for sure.
Okay, good. When the tenderness goes away, that's a major sign of improvement. But I'm talking about movement.
I don't know.
Well, we're going to check it in a second. Good. Coming on the other side, I'm going to do a little bit more focused release on that SI joint. Good. Do. Misfire. There it goes. Okay. Zach, come back here. Actually, one more time. Good. Yeah, come back here and look at his feet now. This one is totally, yeah. This one actually turned out a little bit now compared to when, right after the ring dinger, but this one is completely neutral. It was turned out this way about 30 degrees. So that is probably coming from too much jamming up in here, causing your feet to turn out. Then when you walk, you're not walking correctly, and all that starts to spiral into more and more problems.
Right.
So when you're lined up, just like any moving mechanism, when it's tuned up and lined up and it moves, it's most efficient. Same thing with your body and your bones and your joints. So now I'm going to check the range of motion in the SI joints. Lift as high as you can, no bend. Nice, and down. Did that feel less pinching? You said it was pinching before?
Yeah.
Do the other side. Do the other side. Wow, that went up very nice. Less pinching on this side?
Yeah.
Good. So those are my indications for you and for the people out there watching that this is very nicely released. Is it perfect? No, but it's way better than it was walking in here. Now I'm going to do a little bit of release in your lumbar spine, going up the spine a little bit. Then we're going to move up here and do some more in the middle back and the neck. Good. Oof, that was a nice crunchy one. Good. Yeah, this one was good, and this one wasn't good coming off the ring dinger. Then I did the drops. This one got better, and this one's a little rotated. There it is. Got some tightness right here in the glute.
Yeah, feel it all the way up.
Now I'm getting obsessed about that one leg. I'm going to use the massage gun a little bit to see if I can relax that glute.
Yeah, please.
If this is too, this is a strong one. If it's too much, let me know. I know you're sensitive already. You all right? Yeah. All right, a little bit better, but not perfect. We'll see what happens after we do a little bit more down there. All right. Now, I'm lifting up the belly. Now we're going to do some drops through the thoracics and the lower neck. Oops, wrong one. Stay relaxed. Good. Good. Now we're going to do the transition between the neck and the shoulders that I was telling you was pretty jammed up. Good. Nice. You okay?
Yeah.
Just making sure, because sometimes this is a little intense for people. Nice. Question, is that as sore as it used to be?
Not as sore, but still sore.
Yeah, this side's still a little tight. This side feels really good.
Yeah, that I can barely feel it.
Yeah. All right, we're going to try to do a little bit more releasing on that right side. Look up to the sky a little bit. Tilt to the left. Stay relaxed. Let it go. Let it go. Let it go. Good. No popping in there. Okay. Take your right hand, put it back here on your tailbone, palm up, like you're half handcuffed. I'm going to do a little more release with the massage gun. Stay relaxed. Just relax, relax. I'm going to lift you up a little bit, but you stay relaxed. Good. See how that I can get now underneath the shoulder blade. You okay? I know this is intense, but it's very effective. Okay, drop that down. Ba ba ba. Loose, a little bit looser. Progress, not perfection.
Yep.
Okay, roll over on your back. We're going to do a little bit in the upper. We're going to release the clavicles, collarbones. Good. Stay about there. Right, good.
Yep.
Bring your arms out like a T. Okay. Stay relaxed. We're going to do the AC joints, which is where the clavicle or the collarbone attaches to the shoulders. Turn this way. Now we're going to do the SC joints, where the clavicles attach to the sternum or the chest plate. So we're releasing the collarbones on both ends. That'll help potentially with the neck problems. Go in the middle. Help you breathe better. Help with your shoulders. Just overall with better shoulder function. Good. Good. All right. Rest your hands up top wherever you're comfortable.
That's good.
Yep. Okay. Now, which is the bad side? You don't got no pull on this side, right?
Yes.
But we could do the toes, but no pull.
Yes.
Okay. So now I'm oriented. So we're going to start on this side anyway. So first thing I want to do is just do a little knee pull on this side.
Okay.
Should open up the knee if it needs it. Maybe even more in the hip and the lower back. Mm-hmm. What you got to do to help me is just give me a loose floppy leg.
Okay.
And I'll do the rest. Drop it in my hand. Loose and floppy. Flaccid and relaxed. Nice. Slide back up. Now we're going to pop the toes. Nice. Good. Now we're going to do a little tug at the ankle. Stay relaxed. Nice. Only toes on this side.
Yep.
These toes aren't as poppable. Good.
I'm very proud of myself.
Yeah, you're a popper. I can tell. All right. Okay. Let me just see something here. I'm going to do a little bit of a drop in the anterior for the hip. Good. Good. Trying to get that rotation out a little bit better. It's all right. It's improved. It's not perfect. All right. Done here on this table. So when you're ready, make your way back up on your feet, slow and smooth. And I want you to come sit here on the stool again, facing that way. Good. Now we're going to just want to recheck. The neck was pretty good to begin with. Feeling good and smooth though?
Yeah.
Anything catching or pinching when I go backwards?
Yeah, that one's still got pain like back in here.
In here?
Yeah.
Okay. I'm going to use the massage gun again. You're getting the massage gun a lot today, buddy.
Yeah. Noticed sometimes the only time I can crack up there my neck is after either
We're using the double pronged one. We're just doing a little tapping up there. It affects the muscles, what's called the Golgi tendon in the muscle, to help relax it. Okay, then I'm just gonna do light vibration in your neck, but I'm gonna move your neck around while I'm vibrating. If anything doesn't feel good, let me know. Good. We'll see if we get a little less pinching. Okay, come back. Is that a little bit more released or not?
slight.
Slightly. Okay, we'll leave that for another day.
Mm-hmm.
But posture, your shoulders are back, and you're only about a 1/4 inch forward head posture. What did I say before? I wrote it down right here. Oh, I didn't write it down. What was it? Did I measure it before?
I don't think so.
All right. Oh, well, I didn't measure it. But it's definitely better than it was before. I didn't get a number from before. Okay, so now we're going to do is going to finish off. We're going to adjust the ball and socket, the elbow, the wrist, the fingers, both sides, and we're going to call it quits for today. See how you feel. Start on this side. Bend it up in front like so. Okay, I got to wrap my arms around you, give you a little hug, get both hands underneath your elbow, and I'm going to do a little pop up this way. So to mind your fist with your face, look forward, stay neutral, relax it, let it go. Good. Little release there. Give me this side now. Stay loose. Relax. Let it go. Let it go. Good. Now turn 90 degrees towards this way. Going to do a little bit in the elbow. Nothing too crazy. Let it go. Good. A little bit in the wrist. Loose and floppy. Good. There we go. Pull back towards you. Pull. Pull. There we go. Nice. Now rotate so I get the other elbow. Come this way, that way. I don't care as long as you get there. Drop into my hands. Loose. Loose. Good. Wrist. Good. There it goes. Pull. Good. Don't go down. It goes up. Done.
Very nice.
All right. Turn around. Let's talk, but we'll look at the camera. So give me your impression. How'd that do?
Overall, yeah, really good. The ring dinger is definitely the best part, I think.
Yeah. Big release.
After that, and then especially, working the SI joints, I don't think I've ever felt that area of my, back and hips that loose.
Yeah, they definitely improved the range of motion. Yeah. And we got it up before and after. We got it on the video, too, for proof.
Oh, yeah. Looking forward to that.
Pain-wise, you told me when we did when you walked in, when we were doing the health history interview, that you were a 4 or 5 out of 10 in the back sitting there before. What would you say the number is now? Did it any changes?
I mean, there's no pain that I had walking in. A little sore from the adjustments, but yeah, the pain that was there is gone.
Nice. Okay, so that's promising.
Yeah.
Is it going to stay gone? I can't guarantee. But hopefully for a certain period of time. But the fact that it went from a 4 to nothing is a good sign. Everything's a lot more released. The jamming is the underlying cause of the pain. So you get rid of the jamming, and there really should be no need for any inflammation and pain if it stays unjammed.
Right.
So your job is going to be get on that stretcher at home and do a little bit of that on a regular basis to keep you here now that we got you here. And hopefully you'll have longer lasting, results and reduced symptoms.
Awesome.
How's the neck? Anything different in the neck? A little looser? I'm just going over.
Yeah, definitely looser in the neck. I mean, especially when you turn my neck. Yeah, I
felt like
better.
more range of motion?
Yeah.
Good. Anything down that left leg and the foot? Anything, any sciatic pain going there? Anything going on in your foot like right now? It was when you walked in, right?
Yeah.
Okay, good. So that tells me 100% we definitely got pressure off the sciatic nerve, at least for now. But that's good. Your body responded. Some people it doesn't go away until a couple days later or a couple visits later. Honestly, it's the truth. All right, my friend. I think you did good. I appreciate you coming through.
Thank you.
My post-treatment recommendations are ice it if it's sore. No heat. Applied ice is going to be helpful. I wouldn't do any applied heat. You could do like a hot shower. That's not going to bother you. But no applied long-term heat on those areas.
Okay.
Research shows a little walk directly after the treatment helps your body embrace the new alignment and helps with the healing. So if you're game, before you even leave to go home in the car, maybe do a little walk around the parking lot, like a 10-minute walk, moving your arms, like accentuating, swinging your arms as you walk, looking forward as much as possible. And wait 2 or 3 days, because you don't heal today, you get released today. Let it heal for a couple of days before you make a final assessment on how it feels, because it could even get better. Sometimes it goes up, down, then better, better, better. Sometimes it just slowly gets better, better, better over the next couple of days as the body's healing all the soft tissue that was all jammed up and inflamed. That takes a little time.
Yeah.
After 2 or 3 days, if you feel like it's significantly better than it was, but not all the way better, I think with a few more visits, we can even get you further down the road if you choose. So if that's something that happens and you want to come back to improve even more, I think we could do that. Best recommendation, if you can, I don't know when you're going back to Massachusetts, but is weekly until the symptoms resolve. But if you can't do that, just come back as soon as you can. Or if you're back in Massachusetts and you still want to take the drive, we could, down the road sometime, you're always welcome to come back.
Sure.
Any questions?
No, it was a great visit. Thank you.
I appreciate it. Thank you for letting us film, because it gets the word out there to the masses about good chiropractic and how it's helping people. And if you need me, just reach out to this guy, Zach, behind the camera, and he'll help with any questions. Or if you need to talk to me, let him know and I'll get on the phone. Now that you're a patient, you have phone privileges. Onboarding, I don't talk to people. We don't do phone calls because it's more efficient for texting, because sometimes I get barraged by hundreds of people. So I don't want to hire a whole phone, service to do that. This way Zach doesn't get overwhelmed too. But if you have any issues, anything that you're not feeling right about, reach out to Zach, let him know. He'll tell me and I'll call you and we'll do a phone check-in just to make sure you're okay.
Sounds good.
If you're watching this video and you're like, I think I need that, I'm suffering, nobody's helping me, and it looks like something that would be right for you, go with your gut, go with your instincts. And if you're within the tri-state area and you're willing to travel to central New Jersey, come on through and I'll do my very, very best to help you. The best way to reach out is my website, guruchiropractor.com. Go there. All my information's there. My prices are up front. A bunch of information about me, my hours, my location. All that's on my website. There's also a Book Now button. Is that how you did it? Clicked on the Book Now button.
Yep.
Put your name, your cell phone, your email in there. send. It goes to a spreadsheet where Zach gets it, and then he reaches back out to you via text.
Yep.
And then you guys work out questions, and then if you want to make an appointment, you book it. Was it an
Yeah.
easy experience? Was it okay?
It's smooth.
Because
Yeah.
good.
Easy.
Some people kind of freak out that they can't talk to anybody on the phone, but it's just more efficient. That's the way we've been doing it for like 3 or 4 years. So go ahead and get that done. And if you get your appointment and you get here, I promise you, like this guy, I'll work my little ass off to help you out and get you feeling as good as I can. Peace out, love. Have a great summer.